Hi, I'm Yona Reamer, co-founder and CEO of Air Supports. We help FQHCs and community health clinics strengthen their behavioral health programs through a tech-enabled, peer-supported, collaborative care model focused on substance use. Working with us, clinics develop sustainable behavioral health teams while delivering profitable service lines. In the process, they expand access, improve outcomes, and generate dependable revenue without adding operational burden. Across the U.S., the opioid and substance use crisis continues to deepen. Over 100,000 Americans die each year from overdoses, and millions more live with untreated addiction that silently impacts families, workplaces, and entire communities. Primary care and FQHCs are on the front lines, but without the right tools and support, this epidemic remains overwhelming. That's exactly the gap Air Supports is built to solve. Primary care teams, especially, face patients struggling with substance use and mental health conditions, but they rarely have the time or infrastructure to manage them. Despite billions invested, the gap persists. Patients with SUD drive over 4 times the medical spend of others, yet fewer than 3% of primary care providers prescribing MAT feel adequately supported. Community health centers carry this burden, and they need a model that strengthens care while growing revenue and controlling labor costs. ERA equips FQHCs and primary care groups with a hybrid, low-overhead behavioral health care layer, integrating behavioral health managers, peer specialists, and consulting psychiatrists through a purpose-built platform. By embedding directly into existing workflows, we help clinics deliver measurement-based reimbursable care for SUD, mental health, and chronic conditions, expanding access without expanding fixed staff costs. Our approach strengthens each clinic's behavioral ecosystem, driving margin-positive growth with limited downside risk. Meet Alex. At 42, he recently overdosed and is unsure what his next steps are. His primary care provider identifies him through ERA's registry. A peer support specialist, not a stranger, reaches out, building trust and keeping Alex engaged. With coordinated support, MAT, therapy, and peer check-ins, Alex stabilizes, he avoids hospitalization, and returns to work. This is what tailored peer-enabled recovery inside primary care looks like. Because care happens where patients already are, and because peers walk with them, retention lasts. Our programs see over 40% retention after a year, more than double industry averages. That sustained engagement improves clinical scoring, reduces emergency visits, and strengthens FQHC quality metrics, all without adding clinician burnout or fixed costs. ERA creates value across 3 dimensions. Clinically, we expand access and deliver better outcomes. Operationally, our analytics enhance quality and value-based performance. Financially, we generate approximately $250 PMPM in billable revenue at greater than 20% margin to our partner clinics. This is driven by scalable billing, growth with minimal staffing risk. Partners boost profitability while improving both patient and employee experience, generating on average $600 in profitability per patient each year. We begin with FQHCs. 1,100 centers nationwide, serving more than 4 million SUD patients. Our model reduces staffing pressure while adding a reimbursable service line, making adoption frictionless. Each partnership deepens our density and data insights, positioning ERA as a scalable infrastructure for behavioral health integration in community care. Over the long term, this will enable us to finally crack the code in modeling value-based care in SUD. In Washington, D.C., we're live with Unity Healthcare and Whitman Walker Health, 2 of the nation's most forward-thinking FQHCs. In 9 months, we've enrolled nearly 200 patients with high satisfaction, strong clinical outcomes, and positive staff feedback. Providers report that ERA's peer and care managed layers reduce their high-intensity workload and improve the patient clinic experience. Our clinical team in the Mid-Atlantic has rapidly scaled from 2 to 10 clinicians over the last 4 months to meet our partners' demand. In 2026, we're looking to expand to 2 new states, onboard 6 community health centers, and surpass $2 million in ARR. Our partnership with PCAs and large FQHCs will enable participation in shared savings and subcapitation models, further reducing risk while rewarding sustained outcomes. ERA is currently looking to explore clinics that constitute both urban, rural, and suburban locations to further validate and build workflows for tackling the SUD crisis on a national level. Our team combines expertise in value-based care, behavioral innovation, and scalable peer support systems. Backed by Redesign Health and Gray Matter Capital, we've built a sustainable, user-friendly, and robust platform for care delivery and have capital to carry us through 2026. Through the NACHC Accelerator, we seek strategic FQHC partners ready to cut costs, reduce burnout, and make behavioral health sustainable, turning recovery into a core strength of primary care.